Hey everyone, I know you're probably used to Brian doing these videos, but Brian's currently occupied at the high school. So I've been asked to do a quick training update on our CyanoKits. So as most of you may or may not be aware, we are adding CyanoKits back to our trucks, at least to 4 of them. We used to have these some time ago and we got rid of them. However, Hull Gold Mine has provided some funding for us. And we are placing 4 CyanoKits on the trucks. These kits will be placed at EMS 6, EMS 7, EMS 5, and QRV 10. So these will be placed in the controlled substances lockbox on the ambulances. So obviously if you swap units, move into a different truck, you're gonna have to take the kit with you, place it into the different truck. For EMS 7, the kit will go onto QRV 7 when we're running QRV 7. And obviously with the rest of the medications with QRV 7, this has to be taken inside because it can't run too hot or too cold. So again, if this is on QRV 7, it's gonna have to be taken inside with the medication box to be climate temperature controlled. All right, so let's get into a little bit with the CyanoKit. So as we know, our CyanoKit contains hydroxycobalamin for cyanide poisoning. Most likely gonna be ran into at the gold mine, considering that they use cyanide for all of the things that they do. So with your CyanoKit, if you're suspecting cyanide poisoning, you're gonna administer your hydroxycobalamin. So your adult dosage is gonna be 5 grams over 15 minutes. In this kit, it includes a 5-gram vial that can be administered on standing orders once. If you need more, you do have to call and get orders from the physician in order to administer more than the 5 grams. For pediatrics, your dosage is 70 milligrams per kg. And you have to contact med control prior to administering this in a pediatric patient. So in your CyanoKit, it comes with a few things. So you open your kit up, it obviously comes with the hydroxycobalamin. It comes in this little wrapper, glass vial. You have your transfer spike, which we'll go over in a second. You have a 20 drop set vented tubing, and you have your instructions just in case you forget or aren't sure how to administer it. These nice instructions here walk you through how to do everything. And of course this will come on. This is our training kit. It's going to have a gray top on the CyanoKit itself. So the first thing you're going to do, you're also going to need some normal saline. You can use lactated ringers, however, the manufacturer recommends normal saline as your first choice. But again, if you have no normal saline, you can utilize lactated ringers with this. But grab your saline, and you're going to need a dial-a-flow from the truck. So first, we're going to need to reconstitute this medication. So it comes in a powder form in the vial itself. So you need to grab your bag of saline. So the reason we want the again, you have your 1,000 cc bag. So you're going to get your transfer spike. Out and ready. You're gonna make sure you've popped the top off your CyanoKit vial. You're gonna pull the blue tab off of your saline. You're gonna spike your bag, and you're gonna connect it to your vial. Now you need, as I said, 200 cc's. On this vial itself, you can see right here, you have a fill line. That's gonna be your 200 cc's. So recommend holding the bag upright. Obviously, if you turn it upside down, the fluid's gonna start leaking out everywhere. So holding the bag upright, you can spike your CyanoKit. It does take a good amount of pressure. And now you are going to fill your vial to the fill line. So give the bag a good old squeeze. So as you relax, you can see a little bit of red fluid coming back into the bag. That's okay. It gets squeezed back out just as soon as you give the next squeeze. And again, you're just gonna keep going till you make it to the fill line. And as I said, this does take just a little bit of time. All right, so you're at your fill line. You'll go ahead and remove your transfer spike. You probably want to be wearing gloves because you may get some of this fluid kind of everywhere. So remember, with your saline, this now is a open bag, so just be mindful of that, because if you lay it down where you take the transfer spike out and throw it somewhere, you're going to start having fluid go everywhere. So just be careful with that and mindful of where you place your saline bag when you're done. All right, so now you've got your 200 cc's and you're going to gently invert and rock your CyanoKit vial for 60 seconds. So at a minimum, 60 seconds. So inverting, gently rocking. So remember, we're not shaking it. We're just gently inverting it, moving it around, because again, it's being reconstituted. So you got to make sure you really get all that powder that's in this vial reconstituted and mixed with that saline. All right, so after 60 seconds, you've got it inverted, or you've got it reconstituted. So you're gonna hang it. You're gonna take your 20 drop set tubing that comes with the CyanoKit. You're gonna prepare your tubing. Clamp it off. You're gonna spike your CyanoKit. Fill your drip chamber about halfway, and you're going to, of course, bleed your line. So the fluid that's in here, as you can see, is going to come out a dark red color. And before you bleed it all the way, you're also going to want to go ahead and get your dial-of-flow connected and ready. Go ahead and connect your 20 drop set to your dial-of-flow. Go ahead and have it on full open just to bleed your line. So obviously you already have your IV and your patient. You're going to go ahead and bleed your line through the dial-of-flow, get all those air bubbles out. Again, gonna be a dark red color. So now you're going to connect this IV to your patient. So CyanoKit calls for this entire 5-gram vial in an adult being administered over 15 minutes. So if you do the math, that's 266 drops a minute. I don't know about you guys, but that's a lot. Not sure that many of us are going to be able to sit there and have the time to count that. So again, that's why we need the dial-of-flow. You connect the dial-of-flow and you can change your setting to either 260 or 270. Either or is perfectly acceptable. So once you've changed and you set your flow rate to that 260 or 270. Got it connected to your patient. And then you're gonna go ahead and open up your tubing and initiate your treatment. Again, with pediatrics, you have to call and get orders from the ER or from the physician, but for your adults, you can administer this on standing orders. So that's pretty much it for the CyanoKit. If you guys have any questions, please don't hesitate to contact myself, Brian, or Sherry, and we'll be more than happy to answer any questions you guys may have. See you the next time.